All right, welcome everybody. Ooh, this is a great audience. I woke up today with laryngitis, so I have a cough drop in my mouth. Hopefully you can still, I'm not mumbling. But welcome. We have a great lecture tonight. We have Dr. Johnson here from our Orthopedics Sports Medicine Department. And as usual, before we jump into his fantastic presentation, I have a few points of my own. So, thinking about what he's going to talk about, hips and knees and core stability. Oh, you know who that is. There's Dr. Kira doing the plank. That was pre-pregnancy, by the way. And look at over there. I think you see someone in the audience doing an awesome plank. Wow. You were actually a star. So, think about your core. Hello, come on in. And, there he is, Clay, Master Clay. That is the perfect squat, I think. And that doesn't even hurt your knees when you do it right? And then there is, I'm not sure what, I think I'm doing a curl up with a weight, but these are all things that, you might start to think about a bit more after you hear his talk. But I will digress for a moment. Y'all probably know our website, menuforchange.com, and amazingly, didn't know I had it in me. I'm writing a blog periodically, and the most recent one I just put out a few days ago was very special to me. And actually, it's not special because of this picture, but my daughter drew this picture. Isn't that an amazing eye? Wow. So along the lines of something Dr. Kira had said to a patient years ago, I had told someone, I want you to write a letter from your future healthy, happy self to your current self, and tell your current self what an amazing life you have, how healthy you are, and so forth. Give your future self advice to your current self. So she's like, what are you talking about? Thought about this and thought about this, and she came back with this letter, which she allowed me to use. And so I'm going to read it to you. It says, Dear me, in 2020, you will find yourself to be a different person. You lost close to 100 pounds. You are strong mentally, you are active, social, happy, and you are kind. Remember in 2015, you felt all those changes in your body, tingling, mood swings. You will not feel these, or if you do, they will be much less amplified. The struggle was real. That was a key phrase. And now you are through the tunnel and out the other side. I'm so proud of you that you set goals and then broke those goals down into smaller, achievable goals. I'm also proud of how you surrounded yourself with encouraging people to make this happen. You are living life and being a role model to your sons and your husband, and you are motivated to those around you. You know how to plan and prepare healthy, appropriate, portioned meals. And you exercise almost every day, and you're getting 8 to 9 hours of sleep each night. Share your story to help others. It was tough, and you did it. I love you, and I love that you love you now. Keep that up. Always your fiercest champion, me. That just kind of brought a tear to my eye. This is a woman struggling, and she had it in her to look to the future and say, gosh darn it, I want to feel better, I want to function better, I am going to be better, and I owe it to me. I deserve it. And I just wanted to share that inspiring story with you because she's right on. So I'm going to switch over and let Dr. Johnson step up. He is going to talk about hips and knees and core stability and probably more than that. So here we go.
Hi guys, I'm Jeremy Johnson. I'm just going to get my presentation up and moving. Great. So I'll tell you, while we're getting set up, I'll tell you guys a little bit about myself. I grew up in Minnesota, pretty rurally on a farm outside of town, about 350 people. We knew all our neighbors, and if you didn't wave to them in your car, they would ask you what's going wrong when they saw you in the grocery store. So very small town, used to connections and the importance of connections and friendship. And I went to med school in Minnesota, went to public health school there as well. Came out here, discovered that I love Seattle, met my wife here, and besides last year being in Wisconsin, again, a short stint back in the Midwest, we made our home out here, and started working at Polyclinic about 3.5 months ago here in sports medicine. And I had to also give kind of the caveat that sports medicine doesn't mean that you need to be pro athlete or college athlete to come see me. I really believe that anyone that uses their bodies to move around is an athlete. So we're kind of stuck in that sports medicine world because that's what my training is in, but we're all athletes, we all use our muscles, we all use our joints. So I see anyone that, whether they're a small kid or if they're an older adult, coming from all different backgrounds. So if you're asking what sports medicine is, it's for everybody. So my talk today, so if you get dizzy, I want you to just look down. This is a presentation tool called Prezi. It's online, it's free. You guys are interested in making presentations. But it does move around. Most people tolerate it, but if it gets too much, just kind of look down. So today, I really want to talk about more about core stability and how that is so important for our lower extremities and our back, and how important that is. Has anyone ever heard of their core before? Okay, that's a horrible question, but yes. How many of you have done exercises for your core or been in physical therapy for your core? So I'm curious, what are some things you think of when you think of core? Like, what muscles do you think that you're doing? Abdominal. Back. Perfect. So my question is, what is the core? So when I think of the core, and what most research when they're looking at the core, really thinks of anything from the diaphragm down to your knees on the front, sides, and back. Okay. So crunches, although they are important, are not your core. Okay. And the other thing I talk about when I talk about core is, so the core of our body, where our center of gravity is right around our pelvic bone, or pelvic rim, and the kind of bowl that is our pelvis. The muscles that supply our core primarily are stability muscles. So I think of two types of muscles. There's muscles that move our limbs, and there's muscles that support our limbs. Okay? So if you're jogging or walking, a core muscle that I'm going to talk a lot about today is called your gluteus medius or minimus. Funny words, they're made up by anatomists more than 100 years ago. Those are two muscles that are on the outside of your leg. And if I was to flex those muscles, they would do this. Just kind of move out. But unless you're doing dancing or anything like that, you're not really doing that on a regular basis. What those muscles actually do is they keep our pelvis here. They keep it right in the center. And you guys may know that humans are actually quite slow animals, but we are one of the most efficient animals. So if we look at all mammals and say who can run the farthest, humans by far have the most endurance. Who can run the fastest, we are way in the back. And one of the reasons why that is because our bodies are designed to be very efficient. And one of the reasons why they're efficient is how our core works. Okay? So that was a lot, but I think that's a good background to start this talk from. Okay? So what is the core? So I think it's also important to understand the relationships between the abdominal muscles and our leg muscles, and why I think of that as a whole core. So this is a kind of a zoom up into the pelvic area. The muscle you see there with the yellow going up is your abdominal rectus, the muscles that you do crunches for. And this muscle on the inside of the leg is the adductor. I think it's important to show how closely they're been drawn here, and that's very typically when we dissect out and look at these muscles, they're actually interwoven. So you can really think of the muscles here on the inside of your leg as completely connected to the outside of your leg. Again, going back to that stability that's so important. Okay? This is another confusing one. So this is the back muscles, but looking at them from the front. So I think of the pelvis as a bowl. This is the front of the bowl, your pelvic bone. This is the back of the bowl, what you feel on the back here. Okay? This is a muscle called your quadratus lumborum, and this is your hip flexor. You can see that these muscles, again, are interwoven. So really, we can't disconnect the back muscles from muscles that are even coming out the front of our body. Okay? These muscles are super important in keeping our pelvis stable so that our other muscles can do the work. Okay? You guys look a little bit like this is too much anatomy, so I apologize if it is. But the whole point of all this is not to learn the names of the muscles. It's really to learn the fact that this is all connected, and that if we want to be strong here and have less pain in our hips and less pain in our knees, that we have to have the muscles that function to keep our pelvis stable. Okay? I'll get a little bit more in stability because I'm going to break that into both dynamic stability, meaning that while you're moving, and static stability, which means when you're standing still. Okay? So this is another picture now just looking from the back. So this is your long back muscles, the ones that run the whole way up your spine. And then again, this is your quadratus lumborum. And your quadratus lumborum connects to the muscles that go up front, but also connects to your butt muscles, your gluteal muscles. And again, those fibers are interwoven, so you can't separate them. Okay, I think that's enough of that point. These muscles right here are your gluteus medius and gluteus minimus. Those are our abductors. Okay? When we have weak abductors, we walk like this. Okay? You guys have ever seen that? So every patient that comes in to see me, if they have a back issue, a hip issue, a knee issue, or ankle issue, I have them do a one-legged squat. And I can tell you 90% of people, so I hold them, I make sure they don't fall. Okay? 90% of people, maybe I should not, if you guys feel comfortable doing a one-legged squat, we can have you stand up and do one. Okay? So what I look for is when they do a one-legged squat, now grab a chair if you feel uneasy. Okay? What I look for is your pelvis dropping like this, and is your knee coming in like this? Okay? So what we want is that the pelvis stays completely stable. So usually I have people do this in front of a mirror, and I want their knee to come straight over their toe. Okay? Why is that important? Because if our knee does this, and our hip does this, the forces go up 2 to 3 times on our knee. Okay? So it's been proven, and we'll talk a little bit about this, that if you have weak hip abductors and weak hip external rotators, which would make you do this. Oops, well, a little medicine here. If we do this and this, that puts the forces up in your knee a lot. Okay? So I have to be a caveat. I want everyone doing one-legged squats because if you have severe arthritis, meniscal issues, we can modify these exercises so that they don't cause pain. But that is one way of it for function. Okay? Okay, enough anatomy, I think. Why is this important? So, the hip provides dynamic stabilization. So dynamic means movement. So when I'm moving, these muscles are going to be doing different actions when my leg is here versus when it's here versus when it's here, right? And so to do that, it needs stability from the muscles that are in front, the muscles are inside, the muscles on the back, okay? Now, how do they do that? When I think of coordination, I think of my hands. So I'm a drummer. So that's what I did before I did medicine. I did music full time, and I had to learn how to use all 4 limbs. Can't talk at the same while I do it. You know, when I think of coordination, I really think of my hands and the movements there. I don't think of my hip. But those muscles need to be just as coordinated and just as as you move through that movement, they need to be able to switch which muscle that is. So oftentimes people may be strong, they may have endurance, but they don't have muscle coordination. And so sometimes when people go to physical therapy, they say, you know what, I did these exercises, I don't think they were helping me, I didn't feel like I was getting stronger. And the goal of the exercises may be not to get stronger, maybe to actually learn control and what I call muscle control or coordination of that hip. So that's also important. We know that poor dynamics leads to poor movement mechanics, so that's what I talked about. If you have weakness in your core, you're going to be moving in ways that cause more forces on both your hip joint and in your knee. This increases the forces and in turn can lead to injury. So most greater trochanter bursitis, most anterior knee pain comes from issues that are going on with the hip and back. There's a lot of research out there that shows working on these muscles can help the knees and the hip. Okay. So people always ask me, I went to PT and my knee was hurting, but they had me do all these hip exercises. Then I know they have a good PT. Okay. So this is called has anyone ever heard of the Q angle? It's the famous Q angle. So this is a measurement that looks at what's the angle between the knee and the shin bone. And we know that people who have an increased Q angle, so this movement here, are more at risk for having an ACL tear. They're also more at risk for what's called patellofemoral pain. Okay? ACL tear typically happens the most commonly happens actually in young women. We think that part of that is that just anatomy, females are more at risk for an increased Q angle because their hips are wider, so they can have babies. So that's just it's an anatomical fact that we can't really switch. But we do know that muscle, again, activating these same areas, working on these same areas, can help with the sort of dynamic Q angle. Okay? So you should know that this is important. A lot of it has to do with the muscles here. So what's the evidence? So one of the more recent studies, 2015, let's see, we'll start up here. So in 2010, there was a study of 54 sedentary women, and they don't have much exercise in their life. Ages were 20 to 40. All of them had anterior knee pain. When they started the study, they all had the same background, same social economic status. We usually made the same money, and their pain and function scores were about the same. So they randomly assigned them to either getting just exercises for their knee strength, or just exercises for their knee and their hip and their core. And they followed them up at 3, 6, and 12 months. Those folks who had knee and hip exercises not only had better pain scores and better function, but they also sustained those over longer periods of time. So that's one of the most landmark studies. Again, it's a smaller study overall, so it's not the best evidence, but it's one of it is randomized controlled, meaning they looked at 2 different groups. And that's pretty strong evidence that this is good and can help. In 2007, again, an older study, they worked on the hip muscles on the outside, the quad, and the hamstring, which is the muscles in the back. We know that those muscles and weaknesses in those muscles can predict the amount of forces on the knee. And what this study showed is that if you have weakness in those areas, it's about 2 to 3 times the amount of force that your knee is seeing with every step. Okay? So if you think about that, and I'll talk about this in a little bit, your knee, because it's a fulcrum, it's a lever in your body that's lifting up your knee. It sees about 4 times the weight of your body weight. So 1 pound of weight, your knee sees 4 pounds of weight. So, I'm about 165 pounds. My knee sees somewhere between 640 pounds at every step. Okay. So if you think about, again, adding on to that, if I have weakness in certain areas, that's going to add another 2 to 3 times that. We already talked about this. In general, females have larger valgus patterns, which again is that name for the Q angle, compared to men, leading to differences in acute knee injury and patellofemoral pain, which is that anterior knee pain. Okay. The most recent one in 2015 showed that exercise that targets these areas improve movement patterns, including the Q angle, and decrease anterior knee pain. So again, this is a study that's been reproduced over and over again. There's a lot of evidence. There's just a couple studies I chose out today. So what can I do about this? So really, these exercises can be frustrating because oftentimes core stability exercises are not as gratifying as going out for a nice walk, as doing a Tai Chi session or a yoga session where you're also getting some of that release, but they are an important part to add to any workout. I see a lot of runners in my practice, and typically I give them a 10-minute workout thing that works on these areas that they can add to either the beginning or end of your workout. If you guys are working with any sort of physical therapist or any sort of other folks, I think it's really important to learn some of these exercises. And I can actually send my exercises to you if you want to distribute them to the class. Okay. Now granted, some of these exercises are for people for lots of different skill levels, and so I will do the most general ones. If you're not feeling comfortable or if you have pain, I recommend not doing them without kind of supervision and kind of learning how to adjust them. And there's lots of ways to adjust them. Okay. Typically, I think what was also really important is that these are muscles that we don't use every day. So I have a lot of runners who run, 30 plus miles a week. But when I have them lay on their side and I test the strength of this muscle, I can push it down with 2 fingers. And the reason why that is that a lot of the movement that we do from day to day is forward and backwards, right? These muscles are all on the side and the back that help with the stability. So it takes doing them on a regular basis. The good thing is that we can do these in about 10 minutes, and just a little bit goes a long way. Okay. So we're going to talk a little bit more about physics because we're already talking about physics with the core. And I was just going to talk about something I already mentioned about how the knee is a fulcrum. So I'll go back to this. So basically, when you think of a lever arm, the fulcrum is where most of that force is pushed. So the knee, as this quadricep shortens, what it does is bring us up. So where all that force is concentrated is right at our knee joint. So oftentimes I see patients who say, you know what, I'm fine at rest, but when I am going up and down stairs, my knees just hurt. Or if I'm sitting for a long time in a movie theater or in the car, my knee just hurts, and that's because it's more of a flexion. We know, what I just told you earlier, the knee sees 4 times the force for every pound of body weight. So I usually talk about this in terms of osteoarthritis. One of the biggest predictors of osteoarthritis is obesity. And we know that osteoarthritis, just because of extra weight, can cause pain in the knees. But the good news is that in the context of osteoarthritis, exercise and movement can actually help the knees. There's something about the movement of how those knee joint moves next to each other that actually is healthy for the cartilage. So you may have to change the type of movements that you do. So it may be do movements that are less pounding, things like Tai Chi or pool therapy or using a walking device like a cane. But oftentimes people have less pain when they're using these when they keep their body moving. We also know that obesity can predict arthritis in other parts of our body. So if we look at the incidence of hand arthritis in individuals who are either obese or not obese, it's increased in obesity. And we think that's because it's actually some of an inflammatory process. So I don't tell this to be discouraging. I tell you this is because I think it's important to be informed as we go through, and little bits can actually make a lot of change. So just losing 5 pounds can take 20 pounds off each step, and we know that's really important. Most of the studies have shown that if someone loses 10% of their body weight, that their incidence of osteoarthritis goes down by 5% for each BMI. So that's a lot of numbers there. It's not really important to remember them. But basically, decreasing just a small amount can both improve knee pain and decrease your risk for arthritis. We know that for every, I'll go back here. For every half a kilogram, so every pound and so of BMI decrease, sorry, BMI is in kilograms per meter squared, so every half of a BMI decrease that you drop is a 2% decrease in your risk for a knee replacement. So these are just, I think of these as information to take with you, but not to be discouraged.
And are you saying that's a lifetime risk?
Lifetime risk. Yeah. So summary, I know this is a very quick talk. I really want to leave more time for questions. And I didn't have very much information to give because I didn't want it to be too much overwhelming. But core stability is important. It's an important mediator of injury and lower extremity pain. Exercises, we know that exercises that focus on hip stabilization, core strengthening can both improve mechanics as well as decrease pain and improve function. Starting a core strengthening program is an important aspect of any exercise program. And we know that we can add another 5 to 10 minutes onto anything to get some of these exercises in. Weight is a contributor to lower extremity pain and risk for arthritis, and physics are important. Do you guys have any questions? So, yeah.
What can you tell me about the iliotibial band?
I was just going to.
Absolutely. That's very important.
I know.
So I'm just going to go, okay, maybe want to look down. I'm sure there's a faster way to do this, but this is the most way I know to get back. I'm used to this ride, so. Okay. So does this have a pointer?
On the very top. Yeah.
Oh, awesome. Okay. So your IT, so this is looking from the back. Your IT band starts right here in front of these muscles. That's right here. It's a small muscle. It's called the TFL. And basically your glutes that I'm talking about are right here and right here. So your IT band starts here. It goes across your hip joint and actually attaches on below your knee. It's a long, thin strip of tendon. What's important about this is that when we have weak hip abductors, a lot of people, again, have more of this movement. That pulls the IT band over the greater trochanter and causes it to have more friction in that area, and also has more friction in this area. So oftentimes, patients tell me, you know, I've been told I have a really tight IT band, and I do a test on them, and their IT band is actually longer than I would expect. And really what's happening is they are trying to stretch a normal IT band over a longer area because I'm exaggerating my movements, but if they're doing this over and over again, this sort of movement, they're really stretching that IT band over this greater trochanter. So it comes here, comes along here, and then goes down to the knee. When people have IT band bursitis or greater trochanter bursitis, it's right here. That's because it's being stretched over that area. If you strengthen these areas, and more important than strengthening, actually get coordination in those muscles, so they're actually firing at the right time, you can decrease the friction on that area. One way to think about this in terms of coordination is that when they do studies of people who start weightlifting programs, in the first month they increase their strength by 25 to 33%, a quarter to a third. And we know that that increase in strength actually is just due to all those muscle fibers firing together. It's not because they actually have more muscle. Okay? So if these muscle fibers are knowing when to fire, when to go together, you're going to get a lot more stability in that area. So often, I mean, you start with IT band question, but these muscles again also affect the IT band and the greater trochanter. So I can tell you, I see a lot of greater trochanter bursitis. I do inject them with steroids into that bursa. I do it under ultrasound guidance to make sure that it is in the right area. That does not fix the issue. I tell people this is to help with pain. It does not fix the issue. And oftentimes it does help with pain, but I often tell them you're going to come back and see me in 6 to 8 weeks unless you start to really work on the stability there. Did that answer your question? Yeah?
Okay, well, I'm not really a shoe queen, but watching you move suggests to me that maybe wearing flat shoes more often makes a lot of sense. Or be careful about what shoes you're wearing?
You look like you're wearing high heels when you walk back.
Yeah,
Right.
okay.
Right. So I think you make a great point, is that, I made the argument earlier on that you can't separate these muscles from these muscles and these muscles from these muscles. You can't separate the hip from your ankle. And so, part of that Q angle, can you guys see me? Part of that Q angle is your knee coming in.
Yep.
That also has to do with how much your ankle turns in. Okay? So if you have flat feet and your ankles are at normal this, you're going to have a higher Q ankle and more forces on your knee. So oftentimes I give people either insert or those type of things to keep from going there, but usually that's partly anatomy and partly strength. So shoes is important, but it's also just part of the picture. More questions? Yeah?
Well, I'm not sure what osteoarthritis is. What does osteo mean?
Yep. So that's a great question. So when I think of arthritis, I kind of put it in two realms: inflammatory arthritis and degenerative arthritis. And inflammatory arthritis are things like rheumatoid arthritis. Gout can cause inflammatory arthritis. Sometimes certain viruses or infections can cause inflammatory arthritis. That is usually either an autoimmune process, an infectious process, or some sort of substance in the knee. Osteoarthritis is what we used to think of as a non-inflammatory process. It's really three things. So there's a smooth cartilage that's in between joints. So if I'm thinking about the hip, there's a ball of the hip and there's a socket of the hip. Where those two bones touch, there's a thin cartilage that's there that is a very soft and slippery cartilage that allows our hip to move without catching. So part of arthritis is thinning of that cartilage. Another part of arthritis is thinning of the joint space between that we see on x-rays. And really that's a picture of what is going on with that process in terms of the smooth cartilage is thinning between those two, so they're becoming closer together. What I can tell you is that also x-rays, when we look at them, when it's early arthritis, they don't really correlate with pain. So I see people who have moderately bad arthritis on x-rays and have no pain at all. I also see people with a little bit of arthritis and have a lot of pain. In general, it's a slow and progressive disease, meaning that we can't really reverse arthritis, but we can treat arthritis. We know things like moving actually can be very important for that joint space. And there's likely something about the movement that stimulates those cells to keep them healthy. Injury can make arthritis worse. So any sort of fracture in a joint, those type of things. We do know that steroids in joints, there was a question a long time ago that which in the early 80s, there were some studies where they actually took ape models and they put a lot of steroids into their knees, and they found that thinned the cartilage out. So it turns out that when you look at human models and people who have inflammatory arthritis that get steroid shots all the time, that doesn't happen if you do a normal dose. It can actually be protective. So we used to think that there wasn't any sort of inflammation, but we think that there is some inflammation causing that degeneration as well. Does that help? Yeah.
Going back to the IT band.
Yeah.
Are you familiar with foam rollers?
Mm-hmm.
You know how you were talking about how some people think they have tight IT bands, but they're actually overstretched?
Mm-hmm.
Do those foam rollers make them overstretched?
I think they're overstretched usually, and I don't know if there's any research behind this, but my assumption is that they're actually stretching it themselves because of their weakness.
Oh, okay.
Because it's trying to compensate. So there's the top of your IT band has a tiny muscle right here, that TFL, and it's trying to pull you up. It's trying to pull you up, but it can't. And that IT band is actually getting stretched. So one of the main IT stretch is doing this. right? You can stretch it out that way. And that's basically the same sort of movement. If you have weakness in this area, you're actually stretching out with every step. Does that make sense?
Yeah.
So I think, so a lot of people do have tight IT band, and if you do have a tight IT band, foam rollers are a great way to address that. I'm just saying that sometimes people come in and they've been told they have tight IT band, and actually it's really weakness in this area. So it's important to get an assessment to figure out, is this tight IT band or is this weakness in some of the core stability? Yeah.
Your number one specific recommendation for a more mature runner to prevent damage or injury, just something real specific.
So is it okay if I give more than one?
Sure.
Okay. Yep, so the question was it the question you're asking about? The question was, what are the number one specific recommendations for a more mature runner who's young at heart and wants to run? And we're all young at heart, so, you know. So I think there's a couple things that are really important. So one, every runner that I have, I give a core stability workout. Okay, so those are involving, if they can do it, one-legged squats in front of a mirror, where they're watching their pelvis and going down that way and making sure their knee is over their foot. Side planks. Okay, side planks. And if you can, side planks with this. So usually I don't progress that right away. That's kind of, you're adjusting those things. Okay? And so I think that's an important part of that. Other thing I think is important, if you have running shoes, that they're good shoes. So if they're running shoes that are regular running shoes that aren't really light and they're just regular tennis shoes, you should change them every 500 miles. Some people don't keep track of that, so I would say change them at least once a year. If you have shoes that are more than a year old, they're probably not providing much support. But write down the shoes that you like, because then you can find that same brand, that same type. If you have lightweight shoes that are really light, change them every 300 miles. If you can't remember that, you just change them every 6 months. Okay. I think it's really important for runners to be careful that they don't push themselves too far at any one time. So any sort of regular practice of running is much better than running once a month for 5 miles. So I would be forgiving with yourself and say, you know what, I only have 10 minutes. I'm going to run a quarter mile. And that's okay. Because it's better to do that every day, if you have time, than to do it once a month for 2 hours. So I guess the real answer in that is being forgiving to yourself and say, you know what, I really want to be active for 10 minutes. I'm just going to get up and go for a jog or go for a walk. For the health benefits, it is important that your heart rate gets up. So if you're going for a walk, or if you're going for a run, I would recommend that it's not a leisurely walk. It's one that has a little bit more pace to it. Because you want to get that heart rate up every once in a while. We know that that's much better. So someone told me once, that stuck with me, that if you can't walk 3 miles per hour, the Grim Reaper is following you. I think that's really neat. I think a better way of thinking of that is that you should be able to talk, but you shouldn't be able to sing. So, I don't know if anyone, I have a lot of musician friends, so people are singing songs all the time, and then I realize I'm not running hard enough, so they have to run faster. But really, so that's a good, so if you're able to talk with your friend or talk with the person you're walking with, that's okay. But you shouldn't be able to sing, you should be that out of breath. Does that make sense? We know that if someone has a lot of weight, so I would say a BMI over 35. I don't know if you guys have talked about BMI and what that means. So BMI is a very loaded tool. It's a research word that I don't think has a lot of meaning. It doesn't have a lot of meaning to do with someone, how they feel about themselves, how they eat and be healthy, but it's a tool that we have. But if you have a BMI above 35, you want to lose weight first before you start a high impact program. So high impact would be running or jogging. So usually I recommend to someone that says, you know what, I really want to start running. And I usually say, you know, I want you to start walking or doing elliptical or bike. Get your cardiovascular health that way. Once the weight is under, or you have enough strength to support that weight, then I would start to do more running program. That's running specific and not so much of, you know, I'm okay with walking at that level, but I wouldn't have someone start running at that level. We know if you run under 30 miles per week, your risk for arthritis does not go up. So above 30 miles a week, there is a small and probably nominal increase of arthritis.
There's an article, I think in the New York Times, talking about selecting running shoes, or walking shoes for that matter. And it basically discounted the idea of pronation and all these other factors and said, just go find a shoe, walk in, and if you like it, use it. If you quit liking it, go buy something else.
Yeah.
There's a long article, but that's pretty much the
Yeah.
version. And what do you think about that?
Yeah, I actually totally agree with that. So some people like lighter shoes, some people like heavier shoes. And I really think that when I have a runner come in and they may have really bad mechanics, like sometimes, I mean, I'm sure we've all seen runners out there, their arms are flailing everywhere, it looks like they're gonna fall constantly. And if you take that individual and you're like, look, I want you to run perfectly, they may have no pain before, but they're gonna have pain once you try to change all of that. So our bodies all have normal, so, you know, we talk about pronation, which is how much does your foot come in. We talk about supination, which is how does your foot come out, arches versus they're flat or they're high, if your knees come in or the knees go out. You know, all those are important anatomical things that we may not be able to change. What's really important is to listen to your body. I think that's really important in a lot of things. So if you're having increased pain, you should probably not go with that shoe. I have a very specific shoe that I use, and it's because of where the arch is, and it's because of the amount of wear and tear that I can do. My arch is different from everyone else's arch here, and you know, we're all individuals, and so I think that article is getting to the point of, if it works for you, go with it, and your body's going to tell you if it's wrong or not. That said, the shoe is less important than core stability. Yeah, we're good. You want to explain?
Yeah, I wanted to know if you could address the piriformis muscle.
Absolutely. Yeah. So the piriformis. So I used to teach anatomy. So I did when before I was in med school. I would play music at night and teach anatomy during the day. And we always call the piriformis muscle the key to the buttocks.
Yeah.
You guys know this? Have you heard this before? Yeah. So the reason why it's the key to the buttocks is that you use it as a landmark to say everything below this is inferior and everything above this is superior. So that's that. But what's really important with piriformis is that it is a muscle. Its main job is to, well, if you just flex that muscle, it would externally rotate your leg like this. Okay? But again, unless we're doing some sort of crazy dancing, we're not using it for that. What we're using it for is it keeps our leg from coming in, right? So what's the opposite? The opposite of this is this. So it's not working, you're doing this. It's also important because there's about, I don't remember the exact percentage, but I think it's like 10 to 20% of people have their sciatic nerve that goes down the back of their leg pierces their piriformis. Yeah. So if you have a really tight piriformis or a scarred down piriformis, you can't actually get sciatic symptoms from a tight piriformis. I think of it as, I would really caution myself to be like, this is piriformis syndrome. And I think that's something that piriformis syndrome is something where you have sciatic symptoms, but it's coming from your piriformis muscle. It's really hard. It's 3 layers down. It's a deep muscle, and really I think of it with more global function. So I think it's important if you do have sciatic pain that goes down the back of your leg, which is pain that shoots down the back of your leg, and pain in the buttock and pain with some of the maneuvers within that you do in clinic, that stretching that piriformis can be really helpful. One of the stretches I think is most helpful, if you can do it, is yoga, the pigeon pose, I think it's called. Have you guys ever heard of that or seen that? It's basically bringing your leg up in this way. That's a way to stretch it. So,
Thank you.
it's an important part of the stabilizers.
Is there a website that you would recommend as a source for exercises? There's all kinds of things
Boy.
on the internet, but
There's so much out there.
I'm thinking if I can be more specific. I've been on a program for a while. My core, I work on my core, but I'm not as flexible as I'd like to. So I'm looking for something I can go to and have some scientific basis, and I can kind of get some idea of.
Right. So, I'll send this to Susan. So, the organization that I work for is called that I'm a member of, People in Sports Medicine, is called the AMSSM. And they have different areas for patients that talks about these different areas, and they're all research based. The other one would be the ACSM, and they also have exercises on their website. So I'll send these to Susan to make sure you guys have these. But there's too many letters, AMSSM and ACSM.
I have a question
Yeah.
about injuries, and it's kind of generic because there's a million injuries, but a typical scenario would be someone who's a runner, or someone who is used to walking, or someone who's used to doing a certain type of exercise. They enjoy it, it invigorates them, it keeps them alive, and suddenly they injure themselves. It could be their knee, it could be their hip, and then, oh, I can't do this anymore, or I can't do this for a while, and they feel like suddenly they can't do it because maybe some muscles have atrophied and so on.
Right.
So obviously, maybe physical therapy comes into that concept, but what advice do you give someone who's had a simple or a basic injury in terms of how to maintain the rest, thinking about their core, and kind of get back on track?
Right. That's an awesome question. So, how many have had this experience? Yeah. Right. I unfortunately had this experience too for the first time in my life last year. And my experience was, I'm a regular runner, or was a regular runner up until this point. Had a hamstring injury. What was an overuse injury that take a year to get better. And I couldn't run more than half a mile without pain. And I'm sure this is just my story, and I'm sure many of us have had stories like that. I kept on trying, I'd rest, I'd go out, I'd rest for a week, didn't work, rest for 2 weeks, didn't work, rest for 3 weeks, didn't work, went to PT, didn't work. So I also had a wrong diagnosis in there, so that's not important. But I found out that forced me to try new sets of exercises. And so the way I usually bring it up with folks is that it's really important to be creative, and in terms of what you like to do. So I'm from Minnesota. I'm used to hot dish dinners. You guys ever heard of hot dish dinners? You guys know hot dish dinners? So you're going down, and you're like, I'm trying to get this on, I'm trying to get this on, I'm trying to get this on, and you come out at the end of the line, and you have, if you planned correctly, you have 10 things on your plate. That should be the way that you think about ways that you take care of yourself, whether it's exercise, whether it's eating, whether it's emotional health, whether it's connections with friends. Those things, you want to have a smorgasbord, you want a hot dish plate full of all those things. If you do all of one thing, you're in trouble. You're not going to get pie at the end. You're going to miss out on the green jello. Those things are really important. So with my injury, I discovered that, wow, I really love yoga. And I'm so happy I learned that practice, because it obviously has, and everyone has their own things that they love. I can't tell you what to do. But for me, it was the discovery of the also mind-body connection that you can have with yoga and those type of things. And that was a way for me to channel that energy that I usually got with running. And so this injury happened a year and a half ago. The first time that I ran over 4 miles was a month ago since then. And that was a huge change in my life, but honestly, I'm really, in a way, happy, because now I have yoga as another thing that I can do. I also discovered bouldering because of it. So I'm not, I think it's important to think of it as a way of, let's try all these other things, and when you're healthy, try out as many things as you can, and figure out the ones you like. If you don't like them, let them go about the side. So I think that's the hardest thing is I had 3 patients come to me and they said, I just want to know what exercises I should do. And I said, well, what do you like? And then I try to be quiet. Right? So they might just say me one thing, so what else? And really, we should all have a list of 10 things that we can say, you know what, these are things that I kind of like doing. And if, figuring out what works best for you is really important. And you may be surprised. I have one patient that found out they love pickleball. And another patient who has never been bowling before until 2 months ago, and now bowls 3 days a week. And she's just like, I love bowling, and she never knew it. Anyway, so that's how I think about it. It is an opportunity to be creative. Well, now while you're injured, if you're thinking like me, if someone told me that, I'd be like, whatever. I don't want to be creative right now. What I want to do is what I used to do. So, but that's okay. You can be angry. Injuries can be very angry. Pain can be debilitating in many ways. And I think it's really important to think about these things in a way of approaching life. Is the same thing. You want to have room for pie at the end.
Can I ask one last nosy question?
Yes.
Since I have cousins and friends in Minnesota, what city did you grow up in at 300?
The name of the city is Barrett, Minnesota. It's by Alexandria.
Okay.
Pretty small. Okay. So go ahead.
Were you for the Vikings or the Seahawks?
Yeah.
So I'm okay with that. So I'm definitely a Vikings fan, but I was not surprised because they have broken my heart many, many times. It must be it's very nice to be in a city where they go to the Super Bowl 2 times in a year. Okay.
Bring on
Right.
the Panthers,
Yeah.
right?
All right, so I will send the information to Susan that I talked about. So one is the exercises and one is those websites. So make sure that you guys have those. If you guys have other questions, I'm assuming you can direct them through Susan.
Well, for those who have to leave, please drive safely. I am so excited that you gave that talk, and I loved your answer to my injury question. That was perfect. Right. If you want to stay around, we can just do some more questions.
Yeah,
But thank you so much.
Yeah.